respected judges. My name is Nadia Christy from Smaklapan Penabur, Jakarta, and today I'll be sharing my research titled The Implementation of the In Silico Method in studying the potential of ligand pairings from bioactive compounds of Rambutan, Nephelium lappaceum L. Epicarp, as an inhibitor for the treatment of Alzheimer's disease. Alzheimer's disease is a chronic disease that causes the brain to shrink with age. Disruptions in connections between the neurons in the entorhinal cortex and hippocampus causes memory loss in patients suffering Alzheimer's. Until now, the main cause of Alzheimer's is still unknown due to the complexity of the brain and late diagnosis. However, protein dysfunction is one of the causes of Alzheimer's, as it causes protein aggregation, neuroinflammation, and oxidative stress. Therefore, this research aims to explore a potential treatment method for Alzheimer's by binding effective ligand pairs with the bioactive compounds from Rambutan. As you can see, behind me is a Rambutan tree, which shows the high availability of Rambutans produced in Indonesia. In addition, the Epicarp of Rambutan contains the following bioactive compounds, which contain antioxidant and anti-inflammatory properties, as well as properties that can help to reduce beta-amyloid plaques and protein dysfunctions as some causes of Alzheimer's. Due to the relatively small size of the ligands and proteins used, in silico molecular docking will be conducted to predict the binding energies and interactions of the complexes. Therefore, it is very important to increase binding efficiency to accelerate the time taken in the treatment of Alzheimer's disease by using ligand pairings so that two target proteins can be targeted at the same time. Therefore, this research aims to use and find effective bioactive compounds as ligand pairs from Nephelium lappaceum L so that they can act as inhibitors to treat Alzheimer's disease by targeting the following proteins. It is hoped that through this research, it can help in the findings for the cure of Alzheimer's disease to help cure patients and also develop safer and more effective drugs. Research is a quantitative research with an in silico experimental method conducted on lab. These are the tools and materials used. There are two stages of molecular docking before the data collection and analysis. The first stage starts with the toxicity and drug likeness selection by using Swiss ADME and the Lipinski's rule of 5, where eventually 7 of the 14 bioactive compounds from Nephelium lappaceum L were selected to be the ligands docked. The 3D models of the proteins and ligands from RCSB and PubChem database are being prepared in Autodoc tools. The proteins are being prepared by adding charges and also removing water molecules, while the ligands are being prepared by setting up torsions. Once the binding site and center coordinates have been defined, the 140 complexes are being docked, and the 3 protein ligand complexes with the most negative binding energies will be used again in stage 2 of molecular docking. In the second stage, the combination of ligand pairs were determined, and the chemical linkers were added between the 2 ligands that will pair up based on the distances of the interacting binding pockets. Then, each ligand pair is docked with 2 target proteins one by one. The following data are obtained and analyzed using Discovery Studio Visualizer and PyMol using the following formulas. The ligands that pass the selection and analysis will be selected to be the potential inhibitors for the treatment of Alzheimer's disease. From the 140 protein ligand complexes docked, the 3 protein ligand complexes with the lowest binding energies were IL-10 bound with ethyl acetate with a binding energy of negative 3.1 kilocalories per mole, BACE1 bound with acetone with a binding energy of negative 2.6 kilocalories per mole, and AKT1 bound with dimethyl sulfoxide, or DMSO, with a binding energy of negative 2.3 kilocalories per mole. Therefore, the ligands ethyl acetate, acetone, and DMSO will be paired in different combinations to increase efficiency in preventing protein dysfunction. For target proteins, APBB1 and tau MAPT will also be redocked, as they are significant contributors in relation to Alzheimer's disease, since they associate with the buildup of amyloid plaques and also neurofibrillary tangles respectively. Therefore, it is very important that ligand pairs are able to bind strongly into the binding pocket, as it helps to inhibit the protein and prevent dysfunction. Now, this strong binding is indicated by lower binding energies, in which this table shows all the binding energies from all the protein ligand pair complexes. After this, all interactions of all protein ligand pair complexes are analyzed. From this table, we can see that for hydrogen bonds, there are 5 values which exceed the ideal range, with ligand pair DMSO ethyl acetate having the least number of non-ideal values, and is therefore the most stable ligand pair in the case of hydrogen bonds, due to strong electrostatic attractions and no significant steric repulsions. For salt bridges, we can see that there are 4 values that were lesser than the ideal range, and there are 2 dockings involving APBB1 which have no salt bridges due to a hydrophobic binding site consisting of residues like isoleucine, tryptophan, and threonine. From this data, we can conclude that the ligand pairs acetone DMSO and DMSO ethyl acetate have the most number of ideal values and therefore the strongest salt bridge interactions. For peptide stacking, 3 of the values exceeded the ideal range, but the ligand pair DMSO ethyl acetate's values were always consistently within the ideal range, demonstrating greater stability. The hydrophobic interactions were within range in 10 out of 12 docking simulations overall, except for the simulations involving IL-10 and APBB1, both with the ligand pair ethyl acetate acetone, indicating a lack of hydrophobic regions. Overall, although the ligand pair ethyl acetate acetone had the strongest binding energy of negative 6.5 kilocalories per mole, the ligand pair DMSO ethyl acetate, with also a strong binding energy of negative 6 kilocalories per mole, had the most stable interactions, proving the hypothesis, with only 2 interaction values that were not within the ideal range. Therefore, it can be concluded that from the bioactive compounds of Nephilium lapacum L, the ligand pair DMSO ethyl acetate has the highest potential as an inhibitor in the treatment of Alzheimer's disease. Thank you.